Good morning, everyone. Welcome to today's Breast Cancer Awareness webinar, Don't Let Breast Health Slip Away. My name is Charmaine, and we're gathered here today for this very meaningful conversation on our breast cancer journey in Singapore. This webinar is jointly organized by the Singapore Cancer Society, National University Cancer Institute, Singapore Breast Cancer Foundation, National Cancer Centre Singapore, Tan Tock Seng Hospital, and Health Promotion Board. Just a quick background about who Singapore Cancer Society is. They are a community-based voluntary welfare organization with a mission to minimize cancer and maximize lives through its programs. Some of their programs include public education, screening, patient care services to needy patients, hospice home care, financial assistance such as cancer treatment subsidy, and rehabilitation support programs. We will be taking questions at the end, so feel free to think of some and fire them away in the Q&A or comment section, and we will address them at the end of the webinar. We will also be sharing key information and useful links in the chat box, so do keep your eyes peeled for those. We are now in October, and October is the National Breast Cancer Awareness Month. Today, we will be going through the various aspects of breast cancer journey in Singapore, from risks to screening, diagnosis, treatment to diet. According to the latest Singapore Cancer Registry Annual Report 2021, on average, there are about 7 new breast cancer diagnoses every day. And it is crucial for women to understand their risk and learn about how they can win in the fight against breast cancer. Well, first and foremost, let me share a little bit about myself. My name is Charmaine. I am a breast cancer survivor. I was diagnosed with stage 3 triple-negative breast cancer 3 years ago. I went through a year's worth of treatment. I had 16 sessions of chemo, 18 sessions of immunotherapy, 20 sessions of radiotherapy. I had lumpectomy surgery. And unfortunately, I had a bunch of complications which came along the way, and now it's become a lifelong condition which I manage with medication daily. I am a fierce advocate of breast cancer awareness. I've been volunteering with BCF since 2022, right after my treatment. I do sharing of my stories with people in corporate organizations, in hopes that, maybe my pain would be a catalyst for someone's healing. I also believe strongly in giving back. For all the good that I've received, I would like to pay it forward a little bit. And I volunteer with Fashion for Cancer. It is a nonprofit fundraiser. Its beneficiary is actually National Cancer Centre. And as a cancer survivor, I live life to the fullest. I try to make the best of what I have every day. And this year, because life is short, I decided that I will pour my heart and soul into building my own sourdough cracker brand called Ellie's Atas Crackers. So this is not an ad, but yeah, you guys maybe later check it out. So enough about myself. Today, we have with us 4 panelists from the breast cancer community. Dr. Ang Wei Wen. He's a consultant, breast and endocrine surgery from Tan Tock Seng Hospital. Dr. Eric Fang, who is a consultant, Department of Diagnostic Imaging, National University Hospital. Dr. Bernard Chua, Associate Consultant, Department of Breast and Gynecology, Division of Medical Oncology, National Cancer Singapore. And Ms. Lau Tzu Ching, Principal Dietitian, Singapore Cancer Society. So, let's kick off with Dr. Ang. Welcome, Dr. Ang. Dr. Ang is a consultant from the Breast and Endocrine Service, Department of General Surgery at Tan Tock Seng Hospital. With over a decade of surgical experience, his main areas of interest are breast cancer treatment and oncoplastic surgery. He is also an active clinical lecturer at NUS and NTU School of Medicine, and serves as an Associate Program Director for Postgraduate Year 1 Committee. Dr. Ang, take it away.
Thank you so much, Amin. Let's just get our slides. Hi everyone, my name is Dr. Ang. I am a consultant at Tan Tock Seng Hospital with the breast surgery team. And it's an honor to be invited today to talk to you a little bit about breast cancer and breast surgery and create more awareness towards breast cancer screening as well. Okay, let's begin. All right, today's topics that we'll be covering, a little bit on the overview, how common is breast cancer in Singapore, risk factors for breast cancer as an individual, signs and symptoms you should look out for, and of course, a little bit on breast surgery, the types of surgery that we would offer, other modalities that you may encounter if you are diagnosed with breast cancer, and also some of the side effects of surgery as well. So let's begin. As quoted previously, the annual report from 2021 from the Singapore Cancer Registry, female breast cancer was still the leading incidence of cancer and also the top cause of mortality, meaning among all the cancers diagnosed among women, breast cancer was the most common, and for the most common deaths among women, it was also breast cancer as well. So you can see, as what they've said just now, how common is breast cancer. Based on the registry, almost an average of 7 women get diagnosed with cancer on a daily basis. And as you can see at the bottom, survival gradually decreases as well. And we'll be covering on some topics on how you can pick up breast cancer early and also what kind of treatments are available as well. Okay. So it accounts for almost 30% of all cancers diagnosed in females. And if you give an average itself, almost 1 in 13 women will actually get breast cancer in their lifetime. Of course, when we say 1 in 13, it includes a whole varied spectrum of really early breast cancer all the way to very advanced stages, with the majority obviously being in the early breast cancer. So just a little bit of a preview on how breast cancer actually occurs. If you look at this slide, it may be a little bit busy, but if you follow my pointer, all right, on the left, you can see this is a diagrammatic representation of the breast from the side view. You can see the nipple, and then going in, you get your ducts as well as the lobules as well. And in the rest of the breast itself is made up of fatty tissue. So where cancer commonly occurs is usually in what we call the ducts. So you can see ductal cancer. Ductal cancer is by far the most common breast cancer that we encounter in our practice itself. Of course, there is a certain percentage of people that can develop cancer within the lobules, and lobules are the areas where actually milk is produced. But most commonly, actually, the cancer grows within the ducts itself, and they are all leading up to the nipple. So if you look here, from the benign side, this is a cross-section of actually the ducts in your breast. You can see it's very nice and pristine. So this will be what we see in like a normal person. But subsequently, over time and multiple cycles of maybe hormone exposure as well, you may start accumulating maybe some abnormal cells within the duct. And over time, as this multiply and there are some changes or replication, and it can eventually develop into actually what is known as cancerous cells. And if you look here, we have this term in situ, where the abnormal cells are actually fully isolated within the duct itself. And of course, once it becomes invasive, it is where it's spread out of the duct. And of course, in metastatic cases, where it means that it's spread to the rest of the body, the tumor cells have actually escaped from the duct itself and entered either into the lymphatics or the bloodstream and spread to other places. And this, on average, is usually how the progression of a normal duct all the way to a metastatic disease occurs. Of course, the time frame is always very variable based on individuals. Some people progress through this process very rapidly, and some people, it takes years even to just get to this stage as well. Okay. So this slide is just to show you the different stages of breast cancer. Stage 0 is what we call the in situ carcinoma, where if you look back at this slide, it's actually the cancer is still well localized within the duct itself and it's not spread out. So for cases that are actually stage 0 and they receive adequate therapy, treatment, they actually have almost a close to 100% survival rate at a 5-year mark compared to like a normal person without breast cancer, which is truly amazing. And that's what we try to hope to target everybody, picking them up at stage 0 or even stage 1 or stage 2 as well. So you can see when you're stage 0, 1, and 2, you are more or less almost considered as fully cured of the treatment at the 5-year mark. The moment you enter a stage 3 or stage 4 disease, of course, the mortality rate does increase and the survival rate also decreases as well. So really the best time to get, not say best time to get cancer, but the best time to catch it would be at a stage 0 or stage 1 a point in time. So you must be wondering to yourself, who is exactly at risk of breast cancer? You hear stories. I have like an aunt, she was super healthy, she's a vegetarian, she exercised all the time, but she still developed breast cancer. So breast cancer can happen in anybody, all right? As long as you have breast and breast tissue, you will have a chance of developing breast cancer. Breast cancer essentially develops within the ducts. So the moment you have that, there is at always risk. But of course, there are certain factors based on population studies that shows that there's an increased risk of breast cancer. So definitely, of course, having a female gender, okay, puts you at risk. This doesn't mean that men do not get breast cancer, okay? The rates of male breast cancer does occur, but of course, it is much lower, maybe less than 1% per year, but we do see it within our practice as well. And of course, with age as well, once you start being above 40 as well, the rates of breast cancer increase. You always hear stories of very young breast cancers. These actually make up the smaller majority of the cancers and even less than 10% of the number of cancers that are diagnosed as well. Family history, of course, having a strong family history, if your first degree relatives, meaning your sisters, your mother had a history of breast cancer, there may be some form of genetic predisposition that may make you at risk of developing breast cancer. And the truly genetic ones, like your BRCA1 and BRCA2, they actually only account for about 5 to 10% of breast cancer, meaning that most breast cancers actually occur spontaneously without any genetic predisposition as well. Okay. Of course, if you had a history of breast cancer before, you are obviously at a higher risk of having breast cancer again. Any previous history of radiation to the chest, okay, some people may have had maybe some other cancers while they were in their youth or even when they were children as well and they received radiation. This has been shown to show an increased risk of developing breast cancer. Other modifiable factors that may affect you having breast cancer would include having a high BMI. Pregnant history, having more children is protective. Having more children at a younger age is protective as well, all right? Breastfeeding, I think this one a lot of people are familiar with. So having actually doing breastfeeding for your children, most of the time recommended more than a year or at least at a year mark serves a protective mechanism. Other areas that also affect it are the menstrual history. This essentially is in correlation to how much of an estrogen progesterone exposure a woman gets throughout her lifetime. So if you start your menses very early and you have your menopause very late, that would indicate that you've gone through more menstrual cycles and that increases your risk as well. Okay, and of course, sometimes using certain types of hormone replacement therapy or oral contraceptive pills in the past does increase. And of course, a lack of exercise, which could be related to the high BMI as well, is a risk factor, and smoking as well. Okay, this is just a slide just to show you kind of a summary of all the things that I've discussed about. Of course, no one individual thing is going to guarantee that you'll get breast cancer. And just because, like say, you exercise a lot doesn't mean that you won't get breast cancer as well. And that's why we recommend all women to actually go for regular screening, because you may not have any of these risk factors, but you will still be at a risk of developing breast cancer that can be detected early with screening purposes. Okay. Things to watch out for, okay? When do you suspect you have breast cancer, okay? When, of course, you are examining your breast and you feel a sudden lump or a mass, okay? This lump or mass may not even cause any pain at all, but it's an unusual feature. It may not be even a lump or a mass, but you just maybe feel some abnormality, a swelling at the part of breast. Maybe it looks more prominent when you look in the mirror as well. Things like skin rashes, skin irritation, or even dimpling of the skin, where it actually looks like the peel of an orange and there's little dimples within it. These also indicate that there may be something sinister occurring. Breast or nipple pain, this one is rather unspecific, but definitely if you have a large mass and it's causing some skin irritation near the nipple as well and causing pain, that may be indicative of something more abnormal, okay? If your nipple suddenly has a retraction, you see it puckering going in, or actually inverting as well, this is also one sign that we do look out for. Rashes, as I mentioned previously, any red, scaly, thickened rash near the nipple especially may indicate also some form of process going on. And of course, nipple discharge. Classically, is described as like maybe a bloody nipple discharge that occurs on one side of the breast. These are actually all risk factors that we look out for in a clinical examination. Okay, so how to identify this? Of course, doing regular breast examination. There are a lot of online resources on how to do regular breast examination, and we recommend women to do it at least once a month by themselves, just to see if there's any new masses or unusual changes. Okay, so common myths that we would like to dispel. Breast cancer is more common in larger breasts. This is untrue, okay? It can occur in any size breast, and just because you have a larger breast doesn't mean that you have a larger risk. If there's no pain, it cannot be cancer. This is also false. A lot of times actually cancer or masses that we detect, patients actually do not feel any symptoms at all other than maybe just a small lump or something that's seen on the imaging itself. Other myths, of course, finding a lump means it's definitely cancer. There are so many benign conditions that are non-cancerous that can actually present as a lump in your breast as well. And it doesn't mean that just because you have a lump, it's definitely going to be breast cancer. And definitely if you feel something, you should actually seek some medical attention and consult from a specialist as well. Okay, we'll go on to the next slide in the interest of time. So other than the breast self-examination, we also recommend people to go for the mammogram screening, which I think my colleague will touch on later. And these are the recommendations that we usually give our patients on how often they should be doing the mammogram as well. Okay, so above 40 to 49, it is recommended to do a yearly mammogram. The moment you're above 50, we will actually recommend a 2-yearly mammogram as well. Okay, and this slide is just to show you, if you do get a lump and you do get detected on, say, maybe mammogram or ultrasound, and we do see something abnormal, usually the next step that we do is to obtain some form of histological diagnosis, which is done with a form of a biopsy. And how a biopsy is done is we're using a special needle, and using the imaging either by a mammogram or an ultrasound, we will actually target the lesion and obtain some cells for further assessment to see whether is it truly cancer or is it something benign that we can leave alone as well. Okay, so I'll just quickly go through the types of breast surgery. Breast surgery itself is very unique. In this day and age, there are multiple ways of removing a breast cancer tumor. It is very dependent on the size of the tumor, the size of the breast itself, and of course, patient preference and what is the expected outcome of the cosmesis. So we can actually just remove one part of the breast, as you can see here in breast conserving surgery. It really depends on the location to the nipple, where it is in the breast, and whether you have enough breast tissue left to reconstruct the breast. And of course, when we use the term mastectomy, this is actually just a medical term that means removing the entire breast. But of course, even in this day and age of mastectomy, there are always options of reconstruction and different ways of doing mastectomy. So gone are the days where the moment you have breast cancer, you're going to end up with removal of the entire breast. Nowadays, there are many options to preserve the cosmesis and the social well-being of the patient. And maybe here I'll just show you there are some new innovations as well, even for mastectomy, where increasingly some people are using keyhole surgery to minimize the scar. And in some areas of the world as well, there is also robotic surgery, and even some of the centers here, they are performing some of these surgeries as well for mastectomies. Okay, just a brief slide on what form of reconstruction there is. You always hear this reconstruction. So classically, of course, implants, where we actually put it in to fill up the space and recreate the breast shape. Other ways that we can reconstruct the breast as well is actually using what we call flaps. And flaps essentially is just removing a part of your body and kind of reforming and reshaping it to create the shape of the breast again for better social well-being. All right? Okay, so just one of my final slides, whether all patients actually do they need surgery. So once you're diagnosed with breast cancer, and for almost most types and stages of cancer, surgery will become an essential part of the treatment. And of course, the earlier the stage, the size, the less aggressive the surgery is required. And most treatments nowadays actually does start with surgery followed by certain adjuvant therapies like radiotherapy or chemotherapy. And in a select number of people, they may actually undergo neoadjuvant chemotherapy before eventual surgery. All right. So just a very quick summary of what neoadjuvant therapy is. So if you look at this term neoadjuvant therapy, it means actually giving therapy before the primary surgery itself. So the idea, if you look at this slide here, this tumor, if you give chemotherapy, you can actually shrink it down. In some cases, it may be even completely removed. And by reducing the size of the tumor, we can do a less radical surgery as well, and actually turn it into like a lumpectomy. And even for some people, there may be actually complete response on the final specimen, meaning that the chemotherapy has actually removed all the cancer cells. But of course, the only way to tell this is on eventual surgery. Okay, this is just my last slide showing roughly what the treatment regimens there are nowadays. These are not definite, but of course, there's a lot of variations in this type of therapy, which I think some of my colleagues will cover later as well. So you can see when you are having like early breast cancer, localized, early stage as well, most of the time you'll get surgery, followed by maybe radiotherapy, hormonal therapy. And in certain type of tumor cells, you may get additional targeted or chemotherapy as well. But in more advanced cases, you may actually receive chemotherapy first to shrink the tumor and then make yourself suitable for surgery, subsequently followed by the adjuvant therapies as well. All right? Okay, I know it's a lot of information, but hopefully this gives you a brief outline on breast cancer as well as breast surgery. And I'll pass the time back to Shameen. Yep.
Thank you very much, Dr. Ang. Those bits of information, I mean, coming as a cancer survivor, it's putting things into perspective, what I've gone through. And very useful information. I mean, ladies out there and men, if you do find something different, please get yourself checked. Don't wait. Next up, we have Dr. Eric Fang. Dr. Fang is a Duke NUS Graduate Medical School alumnus and fellow of the Royal College of Radiologists, UK. He specializes in breast and body imaging. He is also dedicated to advancing patient safety and quality assurance in radiology. So, Dr. Fang, take it away.
Thank you, Charmaine. Okay, let's get the slides. Good morning, everyone. I'm Eric, Dr. Eric from National University Hospital, and I'm a consultant radiologist specializing in breast imaging. Today, my talk will be to encourage everyone to go for breast screening as long as you are 40 years old and above. I'll tell you how it's done, what happens, and where you can go for it, and what happens after that. Let's dive in. I'll focus on a few key areas here. Why do we do breast screening? What does it entail? How is it done? When should I go do breast screening? Where can I do it? And what happens after breast screening is performed? So first and foremost, what is breast cancer and why do we screen for it? Breast cancer is a disease in which cells in the breast grow out of control. And as mentioned by Dr. Ang, it is the most common cancer in women. And from what research has shown, early detection of breast cancer can improve outcome, and screening, most importantly, is fast and simple. This slide reiterates what Dr. Ang also mentioned earlier, whereby breast cancer currently is about 30% of all detected cancers in women based on the 2021 annual report by the Singapore Cancer Registry. And breast cancer also leads in terms of mortality. This slide here shows the frequency on the left and the mortality rate on the right. In both cases, breast cancer is the most common and is the biggest cause of cancer deaths in women. This slide here shows that across time from 1970 to the recent 2021 period, we are seeing a rising incidence of breast cancer from as low as 20 per 100,000 to currently almost 80 per 100,000. But the good thing is we are also seeing high survival rates of patients who are diagnosed with breast cancer. This is in large due to the fact that we are detecting them early. And also mentioned earlier is the fact that the earlier we pick up breast cancer, the better it is for survival. When breast cancer are still localized to the breast, i.e. stage 0 to even stage 2 cancers, survival rates are high and almost 100% in some cases. But when breast cancer spreads out outside the breast to the rest of the body, we're looking at fairly low survival rates. This slide shows the distribution of breast cancer in women during the period from 2018 to 2022. The good news is that for breast cancer detection, we're looking at about 77% of breast cancers detected being low stage, and this is good for treatment outcomes. So the key takeaway from this portion is about why do we screen for breast cancer? And it's really because breast cancer is common. If detected late, it can be quite deadly. The earlier we pick up the breast cancer, the better the outcome, and screening is fast and simple. So some people are worried about doing breast screening. What does it entail? It really means, for the most part, in the national program, doing a mammogram. It's currently the most reliable way of detecting breast cancer. And during a mammogram, we take 2 pictures of each breast. The radiation dose involved is very low in comparison to activities that are highlighted in the slide on the right-hand side. You can see that a mammogram is about the same radiation dose as about 4 chest x-rays, and it's about 10% of the background radiation we get in Singapore every year. And did you know that most cancers that are picked up on mammograms cannot be felt by physical examination? So mammograms actually really allow women to know the health of their breasts. And for the most part, if a mammogram and additional examinations do not reveal cancers, you are likely to do not have breast cancers at all at the point in time of screening. This is a slide showing you how a mammogram looks like on our as we access them on our computers. So by convention, the image on the left is the right breast and then followed by the left breast on the right-hand side. Breast cancers can show up as a density here, visible on mammogram, on the background of breast tissue as well. And from there, we'll do further examinations, be it further imaging or do a biopsy to take some tissue out for further testing. So mammogram is done by using a machine like you can see on the left-hand side. Patient actually stands next to the machine and a paddle is applied to compress the breast. The compression is a necessary part of the process because it, first of all, spreads out the breast tissue, and secondly, reduces the radiation dose overall. I have a quick video here of about 1 minute to show you how mammogram is done using a breast phantom. So when radiographer here actually puts the patient's breast in the machine, compresses it with a paddle, and then takes an image. After that, the paddle is removed, the machine is rotated, so that we can take a mammogram again of the same breast in a different angle, different direction. With the 2 projections, we can then localize any abnormality in the breast fairly accurately. As you can see from the video, the process is fairly fast. Ideally, within 1 minute, you can finish 1 breast, and then after that, the next breast, another minute. So how can I prepare myself for my mammogram? First and foremost, you can schedule the mammogram at a time when your breasts are likely to be the least tender. So avoid the week during a period and a week before that. Usually we advise our patients to come 1 week after the period is over, and that should be the least painful time. Secondly, if you're coming to the hospital for assessment, do bring your prior mammogram images as well. This will help us compare what we see today with what was captured before in a previous mammogram. Also, if necessary, you can consider taking an over-the-counter pain medication about 2 hours before a mammogram, something like Panadol. That will help a lot. And finally, don't use any deodorants before mammogram. Deodorants and other powders can actually cause artifacts to show up on mammograms. You can see white dots that can be mistakenly interpreted as calcifications. So you want to get the best image possible, and we advise patients not to put any substance on their breast before the mammogram itself. Some common questions that we get a lot as radiologists will be, why do we just do a mammogram? Why not do ultrasound as well? The short answer is, ultrasound can be an adjunct. It can help to detect more cancers in patients with dense breasts together in mammogram, but ultrasound by itself cannot detect calcifications reliably. As mentioned earlier, stage 0, the one which has a very high treatment outcome, these are often presented with microcalcifications. So ultrasound is not good for those, and therefore we do not use ultrasound by itself. And also, is compression necessary? Unfortunately, yes. I understand it can cause a lot of discomfort, but actually it's necessary in order to prevent any motion artifact and also to reduce radiation dose overall. So again, as Dr. Ang has mentioned earlier, we have under a national program some guidelines as to when you can go for screening. Essentially, we are asking patients to go for screening when they reach 40 years of age. When you're young, between 40 to 49, mammograms are advised once a year due to the fact that breasts are more dense and detection is more difficult. After the age of 50 is reached, it's once every 2 years, and even above 70 years old, please continue going for mammograms if you are still healthy and able to go to the polyclinic for mammograms. You can do breast screening in many places in Singapore, at polyclinics, both public and private hospitals. And also, we have a MammoBus program where there are subsidized rates given to both first-time screeners as well as repeat screeners, as long as you meet the criteria as listed here. The Singapore Cancer Society also has a program whereby if you are above 50 years old and hold a CHAS card, you can do a mammogram at no charge at the clinic at Bishan. Under the Health Promotion Board's Screen for Life program, mammograms are also subsidized for women above 50 years old, and the eligibility criteria is shown here as well. Do check out the Health Hub website for more details. So what happens after you have done a mammogram at a polyclinic? This mammogram will be read by 2 to 3 radiologists at the hospital. If it's normal, a letter will be sent to your home address to tell you that it's normal and to let you know that the next mammogram will be due either 1 year or 2 years' time. If abnormal, a letter will also be sent to you, but this is to ask you to come to the hospital for further assessment, either to do additional views or to do an ultrasound. Some myths and misconceptions about breast screening. There are many of them, so I'll just go through about 8 to 10 of them. So first and foremost, radiation from mammogram is not dangerous. As seen here, the risk of getting cancer from mammogram is about 1 in 100,000 from doing a mammogram at 40 years old. But the chance of getting cancer is about 1 in 200, so the benefits far outweigh the risk. Secondly, a mammogram report, even if it's normal, doesn't mean that you're set for life. It just means that at this point in time, no cancer is seen, and you should continue doing screening. Thirdly, if there's no family history, you're still at risk of breast cancer. And as mentioned by Dr. Ang, a lot of cancer patients actually have no family history of breast cancer at all. And of course, unfortunately, like most other cancers, the older one is, the higher the chance of getting cancer for any part of the body, including breast cancer. Mammogram does not change the shape of your breast. Even though there's compression applied, it doesn't change it at all. Mammogram screening is not expensive, as shown earlier. A lot of it is subsidized by multiple programs we have in Singapore. Ultrasound screening is an adjunct, not a substitute for mammograms. And breast cancer, if picked up early, is not at all a death sentence. Even patients with breast implants can go for breast screening. The images shown on the right shows mammograms that are taken for patients with breast implant. The top 2 are those with the implants included, and the bottom 2 are taken with the implants displaced backwards posteriorly. Mammogram, yeah, can be painful, but you can do a few things as mentioned earlier, which is to avoid taking mammograms on the week or during a period. You can take paracetamol to help you with pain relief. And finally, we have some new technology to also aid in breast screening, things like MRI, things like automated whole breast ultrasound, 3D mammogram, as well as contrast-enhanced mammogram. But the key message here is that these are generally used as problem-solving tools for different purposes and not substitutes for mammogram screening. With that, I come to the end of my presentation. Thank you very much for your attention. Back to Charmaine.
Thank you very much, Dr. Eric. I mean, you guys out there, if you think that mammogram hurts, it does, but it hurts for like just a microsecond, right? Yeah. I mean, a microsecond is nothing when it saves lives. So up next, we have Dr. Bernard Chua, who is a Associate Consultant in the Division of Medical Oncology at the National Cancer Center Singapore. He specializes in breast cancers and practices at NCCS and CGH. Dr. Chua also has an interest in palliative and supportive care, survivorship, as well as adolescent and young adult oncology. Dr. Bernard, take it away.
Hi, good morning, everyone. My name is Bernard. I'm from National Cancer Center Singapore, and today I'll be speaking about breast cancer diagnosis and treatment. So there are three main types of breast cancer: the hormone positive, the HER2 positive, and the triple negative breast cancer. And this is dependent on the presence or absence of receptors on the surface of the cancer cells. The three receptors that we look at are the estrogen receptor, the progesterone receptor. Both together, we consider them as the hormone receptors, as well as the HER2 receptor. So depending on the presence or absence of these receptors, we categorize patients to these three different groups of breast cancer. So in terms of the proportion of cancers that we see, the hormone-positive breast cancer contributes to the large majority of patients that we see for breast cancer. And the HER2-positive breast cancers contribute about 15 to 20%, with the triple-negative group contributing about 15% as well. In terms of the behavior of breast cancers, triple-negative breast cancer is the most aggressive breast cancer, as compared to the hormone-positive breast cancer, which is less aggressive and has a slower pace of disease. And so the stages of breast cancer, as has been mentioned before, can be separated into stage 0, stage 1 to 3, and stage 4. So in stage 0 cancer, the cancer is localized to the breast and do not yet have the ability to invade the nearby structures. However, in stage 1 to stage 3, which is the bulk of our presentation today, the cancer can have the potential to invade the surrounding structures and even spread to the nearby lymph nodes. For stage 4 cancer, as you can see in the diagram, this means that cancer has spread from the breast to a distant site or organ, such as the liver, the lung, or the brain. So as repeated many times today, early detection saves lives. The earlier the stage that we detect the cancer, the higher the survival rate. So early breast cancer screening is very important. So cancer breakthroughs has been going on for many years, since the 1950s and 60s, where the war on cancer was declared. This resulted in the discovery of targeted therapy in the 2000s, the first targeted therapy that is an ammunition for us to use in this war. And not too long ago, within the last decade, we have the advent of immunotherapy, another weapon in our arsenal. So I'll be speaking about the treatment of early breast cancer, stage 1 to stage 3, and talk a bit about the differences between adjuvant and neoadjuvant treatment. So this is the typical treatment journey of a patient who has surgery, which is the primary treatment of breast cancer, and then they will then go on to receive adjuvant treatment, which includes systemic therapy such as chemotherapy, targeted therapy, followed by radiotherapy and other treatments like hormonal therapy. However, the treatment journey is not as linear as it looks. So to put it in a different way, this is roughly how a patient will go through their treatment journey, where they have 3 to 6 months of chemotherapy. And if they require targeted therapy, this will be started together with chemo and continued even after chemo has been completed, and usually up to a year's duration. After chemotherapy, patients who require radiotherapy will have about 1 to 5 weeks of treatment there. And this is also when hormonal therapy will be started if indicated. And this lasts for a duration between 5 to 10 years. So the purpose of adjuvant treatment, which is treatment given in addition to surgery or after surgery, is to eradicate microscopic disease. So we know that the larger the size of the cancer, the more number of lymph nodes that are affected, the higher the chance of cancer recurring. So we believe this is because of microscopic cancer cells that cannot be detected through scans or cannot be seen during surgery. And so we hope that by giving adjuvant treatment, we can eradicate these microscopic cancer cells and to reduce the risk of relapse and increase the chance of cure. However, for patients who have higher stage disease, meaning larger size cancers or lymph node involvement, they may require neoadjuvant treatment, where the treatment, including chemotherapy, targeted therapy, and immunotherapy, is given before surgery. And then thereafter, they may then go on to require their adjuvant treatment, which may still include systemic therapy, including chemo, targeted therapy, immunotherapy, and hormonal therapy. So in a similar diagram showed before, the aims of neoadjuvant treatment is really to have early systemic control, to quickly send in the police force in to control the riot before it gets worse. And we also want to downsize the breast tumor, which is associated with better surgical outcomes. And this will allow us to see the response of the cancer to the treatment. And as you can see in this diagram, the cancer could stay put and remain the same, reduce in size, or completely disappear. And that's indeed our aim. So the different outcomes of neoadjuvant treatment will be either residual disease or complete response. For patients with complete response, this is associated with better survival. However, for those with residual disease, this suggests that the cancer may be, to a certain degree, resistant to chemotherapy. So in these cases, we may even consider more treatment after surgery to improve the survival of these patients. So as mentioned before, surgery can be divided into either mastectomy or breast-conserving surgery. There are pros and cons for both. However, the survival between breast-conserving surgery and mastectomy are similar. And so where technically feasible, breast-conserving surgery is offered. There is the issue of having clear margins, and this is very important. And on the left part of the diagram, you can see that the yellow-colored cancer cells are completely removed with a margin of healthy tissue in the same specimen. So this suggests that we have removed the cancer cells entirely. However, on the right, you can see that part of the cancer cells are on the edge of the resection margin in blue, and this makes us worry that some of the cancer cells still remain in the patient. Radiotherapy is a very important part of treatment, and this is the delivery of high-energy radiation to the affected area, and this helps to reduce the rates of local recurrence. And this is the treatment journey of a patient doing radiotherapy. They have their consultation with the radiation oncologist, followed by a CT scan to help to prepare and plan the treatment, which they then receive, and then they will have their follow-ups thereafter. So this is a photograph showing how our patients are receiving treatment with our radiation therapists. And for adjuvant chemotherapy, this is the administration of cytotoxic agents or cell-toxic agents. And these are given generally weekly or 3-weekly as an infusion, and the duration of which can last between 3 to 6 months. And this is a picture showing how our patients receive chemotherapy at the chemotherapy suite. So on the left, this is how the cell divides and what we call the cell cycle. So the cell accumulates DNA material and then split into 2 distinct cells. So what chemotherapy does is to try to prevent this from happening. And you can see on the diagram on the right, chemotherapy can be employed to affect the cell cycle at various points to prevent cancer growth. There are many side effects associated with cancer, but not all of them happen at the same time. The more common side effects are like nausea, vomiting, hair loss, as well as reduced appetite. And generally speaking, we have a very strong support system to help patients to go through their chemotherapy journey, not just through educational material. We also have supportive care nurses who can go through and troubleshoot difficult symptoms that patients may experience during their treatment journey. In terms of hormonal therapy, on the picture on the left, you can see that there's an estrogen molecule. When it attaches to the estrogen receptor, then the cell will divide. So by giving hormonal therapy with medications such as tamoxifen and aromatase inhibitors on the right, we aim to block the estrogen receptors or prevent the production of estrogen in the body to stimulate breast cancer. And this should not be confused with hormonal replacement therapy, which aims to increase the level of estrogen, which is not favorable for a patient with breast cancer. There are also side effects, and the common ones include hot flushes, joint aches and stiffness, osteoporosis, and sexual dysfunction. We also have HER2-targeted therapy, where we, similar to employing a sniper in the war zone, where we target the cancer cells by identifying unique receptors on their cell surfaces, and in there, try to destroy the cancer cells with minimal side effects. We also have immunotherapy, and how does this work? Cancer cells actually develop mechanisms to evade the immune system, which should be destroying the cancer cells. However, we employ immunotherapy here to help to heighten the immune system to overcome these mechanisms. And after this, the immune system can then detect these cancer cells and destroy them. So in the last few slides, I will be talking about the treatment of metastatic breast cancer or stage 4 breast cancer. While we cannot cure stage 4 breast cancer, we can still control the cancer. And this aims to reduce or delay the onset of symptoms that come on with the cancer. We are also aiming to maintain the quality of life of the patient and to maintain their functional status and their ability to care for themselves. This very busy slide aims to only show that survival outcomes, even in a stage 4 breast cancer, can still be very good. So in general, this can last between 3 to 5 years, with only the triple negative group having a more dismal survival rate in the stage 4 breast cancer. So in terms of palliative treatment for stage 4 breast cancer, what happens is we employ treatment A, and we obtain disease control. But after some time, the cancer will be resistant and the cancer will start to progress. In that situation, we will change the treatment to treatment B, and then we'll obtain control again until the cancer progresses again. So this cycle continues on and on until the treatment options are exhausted or the patient is no longer fit enough to receive more treatment. In that situation, we will then have to focus on their comfort and their care. So this is my last slide, and I really want to push the message across that early detection is really important, and it allows us to do more to help patients with breast cancer. Thank you for your attention.
Thank you very much, Dr. Bernard. As Dr. Bernard has mentioned, cancer is not a life sentence. There is hope after cancer. There is a great amount of support and resources that's available nowadays. But first of all, you need to get yourself checked. Now, next up, we have Ms. Lau Siqing. Ms. Lau, she is the principal dietitian from Singapore Cancer Society. She holds a bachelor's degree in dietetics and master's in applied gerontology. She had 18 years of clinical dietetics experience in acute hospital and step-down care. Her interest is in cancer and geriatric nutrition care. She enjoys sharing evidence-based nutrition tips and engaging the public to practice a healthy lifestyle, empowering them to take charge of their health and well-being. Ms. Lau, take it away.
Thank you, Charmaine. So today, I would like to talk about nutrition and breast cancer preventions. So my talk will be based on these 10 recommendations for cancer prevention guidelines from American Institute of Cancer Research. So they actually look through the worldwide research and then they consolidate the ones that with stronger evidence and come up with these 10 guidelines here. So look through the guidelines. So guideline number 1 is to ask people to try to maintain a healthy weight throughout their life. So excess body fat will actually cause a lot of metabolic problem, such as chronic inflammations, insulin resistance, etc., and then that increase risk for cancer. And obesity is strongly linked to breast cancer. So it is shown that if you, in the adult life, if you gain a lot of weight, they will actually increase your risk for breast cancer, especially for the postmenopausal cancer, breast cancer. So how do we know our weight status is? We can actually do it via you can check your BMI. So BMI is actually just a simple formula. You put take your weight and then divide it by your height in meter twice, and you get the number. If the number is within 18.5 to 32.9, then your weight is within the normal level. And the bigger the number shows that you are actually more overweight or obese. But then BMI only tells us the weight status. It doesn't really predict our body fat level. So there's another calculations that we can actually do. Is actually to calculate your waist-hip ratios, which you use your waist measurement divided by your hip measurements. Then for female, we want the number to below 0.8. If the number is bigger, that means your waist circumference is bigger, and that is actually indicates that you might have more visceral fat, the worst fat that cause a lot of metabolic problems. Recommendation number 2, it asks us to stay active and encourage exercise. So exercise helps us to prevent obesity. Secondly, for breast cancer prevention, exercise can actually reduce the estrogen hormone in the body. So the recommendations for exercise is to do 150 to 300 minutes of moderate intensity aerobic exercise every week. So intensity does matter. So if you want to gather more benefits and have more trainings for the bodies, right, then we want to aim for a moderate intensity exercise, which your heart pumps more, and then you still can talk in phrases or short sentences by panting a little bit so you can't sing. So vigorous type of exercise is shown to, if you are able, then you can actually engage in more vigorous exercise. So doing a more vigorous exercise shown to be able to protect the premenopausal breast cancer more effectively. So besides that, we also want to train our muscles. So it is recommended to engage in muscle strengthening exercise at least 2 times per week, targeting different muscle groups. Guideline number 3 asks us to eat a diet rich in whole grain vegetables, fruits, and beans. So if you are looking at these, then it is all from plant source. So plant-based diet is shown to reduce risk for cancer. So all the plant-based diet actually is higher in nutritive nutrients, such as fiber, vitamins, minerals, antioxidants, phytochemicals. But then that doesn't mean that we need to switch to a vegetarian diet. So if you can keep at least 2/3 or 3/4 of your diet from plant source, that will actually give you enough protective effects. So talking about healthy diets, then we'll have to talk about this healthy plate. So we actually use health promotion boards come up with these healthy plates to teach Singaporeans to practice healthy eating. And if you follow the portions here, you can see that actually 3/4 of the food sources here is from the plant-based. So it is actually, if you follow these eating patterns, then you're already practicing cancer-reducing diet patterns. So for a healthy diet, we want to aim for a balanced diet. So for the grains, we want to have a higher quality grains, so aim for whole grains more. For proteins, we want healthier proteins, choose more lean meat, and then choose more white meat, which is from chicken and fish mostly. Then you can have lentils, soya products, and low-fat milk product as your protein source. For vegetables, try to make it colorful so that it gives you a wide range of nutrients. And to choose minimally processed foods with less additive. Guideline number 4, it says to limit consumption of red and processed meat. So processed meat is well known that it can actually is linked to a lot of cancer, including colorectal cancer. The evidence for breast cancer is building up also. So when we're talking about processed meats, then we are talking about things like ham, bacon, sausages, deli meat, luncheon meats, all this. There's no safe limits to how much we can eat. So it's good to limit or avoid the processed meat. And if you cook the processed meat under high heat, you grill or barbecue it until it is charred, then actually it will increase the cancer-causing substances in it. As for red meat, the recommendation is to keep red meat intake to less than 500 grams per week. So guideline number 4 is talk about limiting consumption of sugar-sweetened drinks. So all these sugar-sweetened drinks, it doesn't really have too much of nutritive values, and it's full of sugars, have more calories inside there. If you are taking too much, then it leads to obesity, and obesity, it will increase your risk for cancer. So follow the healthy eating guidelines. We don't really, so if you can, it actually says that we should keep the sugars to less than 10% of our total calories intake. So it translates into if most of people can keep the added sugars to less than 8 to 10 teaspoons per day, it is still okay. But if you can further reduce the consumption of sugars to less than 5 teaspoons per day, then that can bring extra benefits. So you can choose more healthier drinks. So plain water will still be the best. Alternatively, you can drink some flavored drinks without sugars added, something like plain tea, plain coffee, flower teas, or fruits-infused drinks. Guideline number 6 tells us to limit consumptions of fast foods and other processed foods that are high in fat, refined starch, and sugars. So all these foods, there's not too much of good nutrients like fiber, vitamins, minerals inside there, and it's usually quite calorie dense, and that leads to obesity as well. Guideline number 7, it talks about limit alcohol consumptions. So alcohol is a known cancer causing agent for quite a lot of cancer, and breast cancer is strongly linked to alcohol consumptions. So and actually alcohol consumption does increase the breast cancer recurrent risk as well. So every 10 grams of alcohol consumed per day will actually increase your risk for all the cancer, general cancer, for 4 to 35%. So for cancer prevention, it is best to avoid alcohol, but if you choose to drink, then you should take it in moderation, which means for female, you can take up to 1 standard drink a day, and 1 standard drink is equal to 1 can of beer, half a glass of wine, so red wine, white wine, so juice is all under this category. Or if let's say you're taking hard liquors, then the amount is only 35 ml per day. Guideline number 8, we do not encourage taking supplements for cancer prevention. So whole food is still the best because of the whole range of vitamins and minerals and the good stuff inside there. And all these nutrients actually work synergistically to give the benefits to our body. But then if you are looking at the isolated form of nutrients, it might not be so well absorbed. And then to date, scientists actually haven't found any specific food or supplements that can eliminate cancer risk. Then actually some of the studies on vitamins consumptions, vitamins and mineral consumptions actually shows that high dose of supplements, usually it outweighs the benefits. It actually gives you more adverse results. And some of the vitamins actually lead to increased risk for cancer. So there's no evidence to support taking supplements to prevent risk for recurring as well. So you only need to take supplements when you have some deficiencies or you're on some treatments that might lead to some deficiency. For example, if you are taking the hormone treatments, then usually doctor will ask you to take vitamin D and calcium to protect your bones. So for mother, breastfeed your baby if you can. So mommy will have lesser risk for breast cancer and ovarian cancer, and baby will have lower risk of becoming obese. Guideline number 10, after the cancer diagnosis, can follow the above recommendation if you can, meaning that if you are well, you're eating well, don't have appetite issues, then we follow healthy eating guidelines. But if you're experiencing some side effects, if you don't have good appetite, then you might need to tweak your diet a little bit. No need to strictly follow the healthy eating guideline. Eating well and giving you the strength is more important. So doctor might ask you to eat some things that doesn't sound so healthy to you. They might ask you not to eat too much of vegetables. They might ask you to include foods like char kway teow or fried foods in your diet, and that is okay. So those are the 10 guidelines for general diet, general cancer preventions. And specifically for breast cancer preventions, research actually shows that food high in carotenoids may lower the risk for estrogen receptor negative type of breast tumor. So includes more bright color foods in your diet, then you will get enough carotenoids. So some things that is in orange, in red colors, in yellow colors, and dark greens foods have higher amounts of carotenoids. And it is also shown that for women who eat more calcium in their diet have lower risk for breast cancer. And after diagnosis, if you are on hormone therapies, then your risk for osteoporosis will actually increase. Then we need to look into the calcium and vitamin D intake. So for this, just include for high calcium sources, it is things like dark green leafy vegetables, and then low-fat dairy products. They can include a little bit of seeds, nuts inside your diet, sesame seeds, these tree nuts, lentils, fish with edible bones, so sardines, the anchovies, and then fortified food, things like tofu, tau gua, calcium-fortified soya milk. All this is good source for calcium. To get the vitamin D, then you can eat a little bit of lentils, nuts, and then fatty fish like salmons. Then the best source is still expose yourself to sun exposures. So 15 minutes, 20 minutes a day. It's good to choose early morning sun or late afternoon sun so that the UV is not that strong. And that's all for my presentations. The picture here is actually our SCS Cancer Rehab Center in NCCS. So if you, because we actually advocate you all to start exercising. So if you are a cancer survivor and then you have some pains or some lymphedema, or if you're weak, you don't know how to start exercise safely, then you can actually ask your doctor to refer you to Cancer Rehab Center. Then we have professional exercise trainer that can guide you along. Thank you. Back to Charmaine.
Thank you very much, Ms. Lau. As you know, as a cancer survivor, what you just shared just reinforces what I believe in. You are what you eat, you are what you put into your body. So eat well, eat healthy, and exercise. So we will now open the floor for Q&A. Feel free to post your questions through the Q&A box or in the comments section on Facebook. Okay, we've got a couple of questions in now. Let me start with the first. How long after my menstrual period before I can check my breast and go for a mammogram?
I think the recommendation is generally to avoid the week of and the week before your period. So generally, if you schedule your mammogram about 1 week after the start of the period, that should be good enough, where the point of pain is the lowest throughout the whole cycle.
Okay, thank you very much. Let's see now. I think this would be a very interesting one. What can I do to ease the side effect of breast cancer treatments like chemo?
Yeah, so there are many side effects for chemotherapy depending on what treatment that we put you through. So depending on the regimen and the drugs that we use, we actually give supportive medications before and after your chemotherapy sessions to help you to deal with these symptoms and to mitigate them. However, during each cycle of treatments, during your visits to the cancer center and the chemotherapy suite, if you have any side effects that you want to clarify and seek help, there are always a lot of nurses and doctors that are available to help you to guide you through them. There are medications that we can help with. And in general, I think keeping a little record of some of the symptoms that you may experience is helpful, and this can help to track from cycle to cycle how you are managing these symptoms. And this can help your report back to your oncologist. And generally, the first cycle is usually the toughest because there are a lot of things that is not expected and you do not predict that they may happen, and they may be the first time you felt these symptoms. So I think having a sort of a symptom diary will be helpful, and then remember to feedback them to your oncologist to help to titrate and adjust your treatment accordingly.
Well, thank you very much. The journal part is actually spot on. I actually did that during my treatment because I had chemo brain as well. So it actually helped. I take minutes during my meetings with my doctor, and that will help in easing whatever symptoms that I had for my next treatment. So next question. Does size really matter? Does your breast size correlate to the risk of you having cancer?
Yes. So from the studies that we've noted, breast size does not correlate with the risk of having breast cancer. Okay? Having a larger breast doesn't increase your risk of having a breast cancer. And of course, having a smaller breast does not reduce your risk of having a breast cancer. The only time that the breast size actually does affect it is in terms of a surgical approach. Definitely, if you have a very large breast with maybe a very small tumor, then it may be easier to just remove the breast and conserve the breast in terms of surgery, as opposed to having a very large tumor in a very small breast, where there may not be much of the breast left after removing the breast tumor. And in that case, then you may have limited options in terms of surgery itself. But there is no data to show that a larger breast increases your risk of having a breast cancer. Yeah.
I'd like to add on to this question. So, while the breast size itself doesn't correlate with the risk of having cancer, the breast density may have. I think, sorry, because breast cancer arises from the breast tissue, if the breast is dense, then there's a greater chance of breast cancer occurring. But at the same time, denser breasts also occur in younger ladies. So this is offset by the fact that patients are still younger. So I would say that if your breast density is high, then the screening guidelines recommend annual screening. This is to compensate for the fact that increased density makes detection harder and puts the risk of cancer higher. But age is one of the protective factors as well if you're young. Likely to be the reason for you having dense breasts.
Thank you very much, gentlemen. I think this next question, I think is a bit personal to me as well. I tested for the BRCA genes. I don't have it. My mother passed away from ovarian cancer, and a lot of people also want to know, if you have family history, but you're not tested, you're tested for the genes, but you don't have it. How do you prevent cancer cells in the body? Is it related to things we eat, or is it something to do with age? Gentlemen, I'll leave it open.
Maybe I'll take this question first, and then maybe Dr. Brennan can help us after that. So how to prevent cancer cells in the body? So there's no real definitive treatment that can prevent cancer cells in the body. These are spontaneous things that occur over the life cycle. In our human body, the cells go through replication, replacement, and it's through this replication and replacement where actually maybe some errors in the genetic material of the cells occurs. And if you accumulate enough of these errors within the genetic material, then that's where cancer actually develops. So there's really nothing specifically that can actually prevent it. And that's why screening is such an important modality in picking up cancer, because we know that through this replication process, you actually start off with like a very early stage of cancer and then subsequently progress into something more invasive. And breast cancer is one of the unique cancers where there's a very cheap, very effective, and very fast way of picking up early breast cancers for adequate treatment itself. Yeah.
Thank you, Dr. Brennan.
Now, to carry on this, I think there is nothing that we can control to reduce the presence of cancer cells in our body. You can have a pristine diet of low fat, high protein, high fiber, but that would not eventually increase or reduce your chance of having breast cancer. And that's why the key message here is to do screening early. And screening allows us to detect cancer cells earlier, and this helps us to address the issue at an earlier stage where treatment is not that intensive. So it's really very important. And I don't think that there's anything specific that we can do for ourselves to reduce and prevent cancer cells in the body.
Well, thank you very much, gentlemen. So yeah, essentially, early detection is still key to saving lives. So, if you do feel anything, please don't wait. Get yourself checked out. So next question, would one still need radiation after mastectomy?
Maybe I'll take that question. So generally, the indications for radiation are when you have lymph node involvement. So this is generally when the cancer has spread to the lymph nodes in the armpit area, and then radiotherapy is required in these situations. Or if you undergo breast conserving surgery where you do not remove the entire breast and you choose to go for a lumpectomy or white excision, and these situations you would need radiotherapy as well. Yep.
Thank you very much, Dr. Bennett. Next up, what is the difference between lumpectomy and white local excision?
Okay. This is a question about the surgical names. So lumpectomy and white local excision, these are just differences in semantics, meaning some surgeons may refer to it as a lumpectomy or white local excision. But essentially, they fall under the group of a breast conserving surgery, and these terms are used interchangeably. So I would say the difference between lumpectomy and white local excision is really just based on whether the surgeon prefers to use either terms. But most cancer surgery essentially is removing the lump itself, which is the tumor, with adequate margins. And the term lumpectomy and white local excision commonly is used interchangeably as well. So we would largely regard it as a similar treatment. Lumpectomy may be more commonly used in terms of maybe a benign condition, and cancer conditions will more commonly refer it to as a white local excision, but essentially they are the similar operation depending on the semantics. Yeah.
Thank you very much. I saw a question earlier about mammogram. Is it, do women age 70 and above need to do a mammogram?
The short answer is yes. We strongly recommend women above 70 to continue mammograms if they are able to go to get one. And the reason is because as our population ages, we are focusing on increasing patients' lifespans and to make them more productive even as we age. So this falls right into the paradigm of screening to pick up cancers early, even in an old age. As long as you're able to, picking up early can help to at least improve your quality of life by 3 to 5 good years. And that in itself is purpose enough, is benefit enough for you to continue screening beyond 70 years old.
Thank you very much. This next one, we've heard the news about Elle Macpherson choosing not to go down the conventional treatment for her cancer. So this next question, I think some people would be very interested to know, can TCM be used during time of cancer treatment? Alternative medicine.
So maybe I'll take that question. So traditional Chinese medicine has a really long history, and we cannot doubt that there is no effect for traditional Chinese medicine. However, during the use of chemotherapy or other agents that we employ during cancer treatment, such as immunotherapy, targeted therapy, it's very important that these treatments are proceeded without any interruptions. And sometimes the use of traditional Chinese medicine can affect the liver or the kidney function and prevent the appropriate processing of our chemotherapy drugs. And that may in turn increase the side effects that patients may encounter. And this may also lead to delays in treatment. So when you would like to try any Chinese medicine, it's best that you speak to your oncologist and check with them before proceeding. I would say that in general, if you are having some herbs and products like ginseng or red dates or wolfberries, in your day-to-day diet, these do not constitute traditional Chinese medicine, but it is more in the sense of a regularly prescribed dosing of herbs in a certain concoction, and that would be what is concerning for us as oncologists.
Thank you very much. I think we have time for one last question. Yeah. Let's see. Is there genetics testing for breast cancer? I think there is the BRCA test.
Yes. Yeah? For breast cancer, there are guidelines as to when we should recommend for genetic testings. And this is usually reserved for patients who are at the age of less than 50 years old, and for patients who have family history, a direct first-degree relative. So either your mother, your grandmother, your sister. If you have family history, then you should highlight to your doctors, and then they can decide whether you require genetic screening. So genetic screening is simple. It's a blood test that is done in the clinic, and this takes about a couple of weeks to turn around before we receive results. Whilst genetic testing is an important part, not everybody or every breast cancer is related to a genetic mutation. But however, if you have such risk factors, as I mentioned before, less than 50 years old, a family history, or even in triple negative breast cancer, then the likelihood of you having a genetic mutation can be just slightly higher than the average population.
Thank you very much. Sorry, we actually have time for one more question. So let me see. I saw something about a meal. What are simple meals that I can make at home as I stay alone and working? I am usually too tired on treatment days. Ms. Lau.
So simple meals. So what we want to is actually to aim for balanced diet. So you can think of some things with simple carbo, some things like maybe wholemeal bread or pita bread, adding a bit of steamed vegetables and meat together, sandwich. So that can be one, or one pot food. So just dump everything together, porridge with vegetables and meat inside there. Rice with steamed with the rice with a bit of vegetables, something like long beans, cabbage, whatever, dumped inside there, and then pair out with some proteins as well. It can be plant proteins, it can be animal proteins, it can be tofu tau guas inside there. So it's all simple. Or noodle soups, same things. Noodles, vegetables, meat.
Thank you very much, Ms. Lau. Just from personal experience, when I was going through chemo on my bad days when I couldn't really eat, I find that eggs really help me. I mean, it's quick to cook. It takes less than 5 minutes, and it's easy to eat, high in protein. So yeah, thank you very much for all these questions. So that's all we have for today. And on behalf of Singapore Cancer Society and our partners, National University Cancer Institute Singapore, Breast Cancer Foundation, National Cancer Center Singapore, Tan Tock Seng Hospital and Health Promotion Board, together with our sponsor AstraZeneca, we would like to thank you for tuning in to our webinar and for actively participating with your questions. We would also like to thank all our speakers for taking time off today. I know today is a Saturday and you guys have time with family or work, I don't know. Thank you very much for taking time to be here today and for your contribution to the breast cancer community. If you wish to rewatch this webinar again, it will be available on the Singapore Cancer Society's Facebook page. And if you know any ladies who wish to be empowered in our fight against breast cancer, you'll be happy to know that Singapore Cancer Society has a clinic at Bishan. They provide free mammogram screenings at no charge all year round. All you need to do is flash your orange or blue CHAS card, visit the Singapore Cancer website or call 1-800-727-3333 for more information. And this year, we have also partnered with the National Volunteer and Philanthropy Center to launch a fundraising campaign on giving.sg, where you can support our breast cancer warriors. So visit giving.sg under BCAM24 to find out more. So thank you all for being here. And just a quick reminder for you guys participating, there is a feedback form that we would very much love you guys to fill up. So please do so via the QR slides, a QR code rather. Thank you very much everyone for being here and have a great day. Bye-bye.